You have reached European Citizens Ask, a podcast by the European Committee of the Regions. Please leave a message after the tone.
Good morning, my name is Susanna. I live in a border region between the Czech Republic and Slovakia. It is not a very populated area, and I find that the access to public services, to transport, to education and healthcare is very limited in comparison to the central regions or capital cities. Can you explain me what Europe is doing to improve the cross-border public services?
Well, thank you, Susanna, for the question. I come from a border region myself, but on the other side of the Czech Republic. I'm from the border of Czech Republic, Germany, and Poland. And you're right, because since these areas are not that much populated and they're far from the capitals, sometimes it's hard to access healthcare, education as well. The transport offers are more limited. So the idea is that sometimes the regions or the cities and municipalities that are responsible for offering the services, it's good to pool resources together with the neighboring municipalities that might be across the border. And then you have enough people actually to provide the service. So the whole idea of cross-border public services is to make them more available and to pool resources and more effective. So there are examples where it's possible. For example, we have two towns that not one of them would have enough costs to provide for the wastewater cleaning station, but they did the sewage across the border and have one together. Also, we are working on, for example, that German hospitals across the border are much closer to the citizens than the hospitals on the Czech side. It takes almost an hour and a half to get to the nearest hospital to give birth. So it makes natural sense that the services could be accessed just across the border, but there are sometimes barriers to this. Because the member states, they provide these services nationally and they don't think across border. So there are some obstacles. For example, you have to have the medical insurance companies on board that they will reimburse the care across the border and not just within the Czech Republic, for example. So some obstacles can be solved easily when it's the competences of the towns, municipalities, regions, then they can agree quite easily. So what we try to do as the Committee of the Regions, we try to advocate for these services to make the idea more spread. We try to define the principles, how they can be established. And we also, as the CUR, called for sometimes an EU framework that would make it more easier. When the states are hesitant to do, we think that the EU should step in and make the services for the citizens more available and possible. So this is what we try to do. Of course, for those of us who live in border regions, this is something natural and we are for that, but the main job is to persuade the states, the member states and the capitals to get them on board, because with some services you cannot do it without their support.
This was European Citizens Ask, a podcast by the European Committee of the Regions, the Assembly of Regional and Local Representatives, with Pavel Branda, Deputy Mayor of Radlo Municipality in the Czech Republic. You too can post your questions about how Europe works at local level, or share the good practices you see at home. Together, let's shape the future of Europe from the ground up.